just hearing from my classmates who had started in practice, and they were saying most of them honestly had terrible experiences when they started out. They were either in internships where they were worked into the ground, or they were promised quote unquote mentorship, but it was never defined. And so 3 to 6 months out, they left their first practice. And so I kept seeing these patterns happen over and over and over again. And I'm like, why am I the outlier? I was like, why is it that here I am 5 years later, I'm still in the same practice. I still freaking love what I'm doing. I still have an awesome mentor. Like, why am I the outlier in this situation?
Welcome to the Paws Effect Podcast. I'm your host, Dr Carra, and today I'm thrilled to be joined by Dr Moriah McCauley, an inspiring veterinary mentor, advocate for professional growth, and podcaster herself. We'll be diving into the power of mentorship in veterinary medicine and how podcasting has expanded the reach of her mentorship. Whether you're a student, a new grad, or a seasoned professional, this episode will offer fresh insights into how we can all help shape the future of veterinary care, one conversation at a time. Don't forget to take the time to like and share and subscribe to this podcast on your preferred podcast platform. You can also follow me on Instagram at Dr_Carra. I'm so pleased we've connected because, obviously vets and podcasters don't always come together because it's a time factor, isn't it? And then the added benefit of the fact that I could talk to you today about mentorship. That is something that I find fascinating, and I think certainly my audience would benefit from hearing a little bit more about. So, what is the work that you're doing as a mentor? So you're a podcaster, you're a veterinarian, you're a practicing veterinarian, meaning that you actually do work. I can see that from your social media stuff. You scrub in, you're working the clinical practice, and then you're a mentor.
Mm-hmm. So I am, practicing small animal general practice here in Virginia. And I don't know, it's like, what is my role exactly? I haven't quite defined it, but I would say that I am like boots on the ground type of mentor within our practice, where when we have pre-vet students or veterinary students come through, I'm the one who connects with them and sits down and says, okay, what do you want to learn? How do we tailor your experience to benefit you and also to benefit the rest of the practice? Because we try and tie in this idea of a culture of mentorship, where it's not just like we're ticking off boxes to get your skills and your tasks done, but how does the process of teaching and the process of mentoring also benefit the staff and the whole team at the clinic by through this mentorship process? So it's like a full circle moment. And I help facilitate a lot of that in my role. And so that's what I do like within the practice. But then outside of that, just with social media, I try and talk a bit more about what mentorship is, what it looks like. Because a lot of vet students, when they graduate, like they've heard mentorship. Like at this point, like obviously when you graduated, when I graduated, mentorship was like maybe mentioned, but it wasn't talked about to the degree that we hear it nowadays. And so vet students, they're graduating, they're like, I need to ask for mentorship. And you're like, yes, but that's about all they get. They don't really get to talk about how do you define mentorship. They don't get to talk about what are the questions that you need to ask to determine if this is a practice that is ready and willing to take on a new graduate, but also is their style of mentorship the kind that would work well for you? And even if it doesn't, how do you have that conversation that brings the expectations of both parties to the same level so you don't have those breakdowns 3 to 6 months in?
I think it's phenomenal. I mean, if I'd been offered a mentor when I qualified, I wonder, the path that I would have taken or some of the struggles that I would have managed differently. And I think, so mentorship is something that is obviously fascinating for me. I mean, and I think we're probably a little bit behind, but I know certainly in South Africa, they're exploring mentorship and it's something they're talking about. But let's talk from the practice perspective. What is the benefit of having a program of mentorship, both in terms of, your vet welfare, but also in terms of productivity?
Mm-hmm. For sure. So there's a couple different facets that we can go into there. So you'll probably have to circle back around on a couple of them. But when we look at mentorship from the benefit of the entire practice, do you want to talk about like the benefit of mentoring like pre-vet and veterinary students or bringing on new graduates? Like what bubble do you want to focus on?
I think I think probably because we have limited interaction. I think probably because the way South Africa is set up, we only have one vet school. So we don't see a huge number of students. We do. We're quite lucky to, and we enjoy having students here. I think it's good for both parties. But we do face in a profession with a huge turnover of staff, we do face new grads applying for positions. And I think, I don't know whether you have a community service year in the US, but we have found, particularly now that there is that expectation that they're out of sort of clinical work and practice, we know as graduates of the Dick Vet that, you go from sort of day one competency to being thrown in the deep end. And you actually, a lot of your learning and experience happens in your first couple of years. Mm-hmm. And it can be a really stressful time. So what we're finding now is for South African vets who are applying for their first official job in private practice or wherever it may be, is that some of them have been out of the game for about a year. They've been working in the middle of nowhere, doing potentially welfare work or meat inspection or lab work. And so not only do they feel out of their depth, it's without a mentor and without sort of the guidance as to how to get yourself into that sort of a sustainable working environment. Mm-hmm. So I'm very interested from the perspective of you applying for your first job, and what a mentor will mean. Not only, obviously we can discuss that, I'd love to hear what it means for the actual professional, but what it means for a practice and why practices should consider having a mentorship or having someone in the practice like you who is guiding that.
Mm-hmm. Oh, definitely. So if we're looking through the lens of what does mentorship look like for the new graduates and how does that reflect on benefiting the practice itself, again, it kind of comes back to that whole idea of a culture of mentorship where you're not just bringing on a new grad and saying, all right, you're going to work for me. You're going to do this thing. I'm going to get more money now because I have a new doctor here. But instead, you're actually sitting them down and you're saying, okay, what are your passions? Where are your current weaknesses? What are the areas that you want to grow in? Where do you want to focus on first? And when you look for addressing, how do you care for this person as a human? How do you care for this person as a growing veterinarian? And you foster those areas that they are excited and passionate about, that has a beautiful knock-on effect to the rest of the practice. Because if everybody is aware of, okay, this is the growth plan that we have for this individual. One, they're looking out for them and saying, hey, you said that you wanted to get better at ultrasound. Do you want me to bring my dog in and we can scan him? Or, hey, the other doctor is doing this surgery. You should go see if you can scrub in. They're looking out for each other. They're consciously thinking of these patterns. And again, those patterns become repetitive and they just become second nature as a result. So when you practice, again, caring for this new grad, caring for how you support them, you start looking for those things in how you care for the rest of your staff members. So you're able to sit down and say, hey, I know you're just one of our kennel techs right now, but I know you want to go to vet school. So how about we sit down and we chat about what you're looking for in a vet school, what you think you need. Let's give you a letter of recommendation, all those little bits and pieces, but you're fostering growth, not just in the individual, but then also in your team. So it's very reflective in how that happens. But again, that culture of mentorship is really the core value that I would say should be the main focus when you're bringing on a new grad.
No, I totally agree. And I think, reflecting on the years of sort of managing this practice and being responsible for the staff, having a situation where you're taking on a new grad or someone new or who's been out of practice for a period of time. It's not only mentorship required necessarily when you first start. There's sometimes if you're changing from mixed practice or large animal practice to small or vice versa, that you could have that kind of guidance because, as you say, practicing those skill sets makes you feel more confident and comfortable and less anxious and, all the knock-on effects of that. But I reflect back and now we don't necessarily in the typical way, and potentially after this conversation that will change, but in the typical way have had a mentorship program. But we have seen with our recent graduate having those sort of expectations, both this is what's expected of you within this practice, But from a learning perspective, this is what you can expect from us. And having that supportive role and, like you say, that learning opportunity to sort of say, we understand that you need to get exposure, like you say, to ultrasound or to whatever skill set that you feel you're nervous about, and that is beneficial for all parties, and that acceptance of not having success or failure, just learning. So it's changing the narrative and changing sort of expectations. I love that, and I think I was thinking I would have loved a mentor. I'm sitting here super envious. That would have been great. But did this now stem out of, and I'm sure people are so sick of COVID and the discussion of that period of time, but did this conversation start when there was a recognition that veterinarians are struggling with their mental health?
It was definitely an aspect of it that played into it, but I think the grander part of why am I passionate about mentorship? Why do I talk about it so much is because of the impact that my mentor had on me. When I started in practice in 2020, yes, it was the height of COVID, and no, I couldn't see my clients face to face. I was doing everything via phone call for the most part, unless it was a euthanasia. And then, of course, I'm in the room and we're gloved and masked, and it was just awkward. But my mentor was incredible and is incredible. He's still my mentor at just bringing me along, really pushing me to try new things, challenge myself. And as I was, of course, doing the podcast at the same time, just having more and more conversations about what does mentorship look like, what's happening in different practices, and also just hearing from my classmates who had started in practice, and they were saying most of them honestly had terrible experiences when they started out. They were either in internships where they were worked into the ground, or they were promised quote unquote mentorship, but it was never defined. And so 3 to 6 months out, they left their first practice. And so I kept seeing these patterns happen over and over and over again. And I'm like, why am I the outlier? I was like, why is it that here I am 5 years later, I'm still in the same practice. I still freaking love what I'm doing. I still have an awesome mentor. Why am I the outlier in this situation? And it all came back to the fact that mentorship was a huge, huge part of it, not just within my practice, but the different mentors that I had outside of my practice. And I'll give a huge shout out to Gary Marshall on this one. He's been a huge, huge support for me, even from when I was going through vet school to graduating to looking at my first job. He definitely gave me some really clear insight and helped me kind of target my thoughts and what I was looking for in a practice and how to ask for mentorship and all these different aspects. So was mental health a component of why I started talking about mentorship? Yes. Because again, I saw my classmates that they were I'm thinking about leaving the profession as a result of poor mentorship. But I think the bigger part of that was, okay, why am I an outlier? And then also, why is it that when we talk about mentorship and really hone down on what it means, the situations improve for a lot of people? So I was like, so we need to talk about not just mentorship, because it was becoming a buzzword at the time. People are like, oh, you need mentorship. Mentorship is great. And I'm like, yes, but unless you define it and you actually set goalposts for it, it's likely to fail. Like any relationship, quite honestly, if you just go into it blind, you're probably going to have struggles. But if you set the expectations, you go into it with open communication, then you're much more likely to succeed.
Hi there, pet parents. This is Dr. Carra, the Ultra Pet Vet. I'm excited to introduce Ultra Pet's premium recipe for miniature and small breeds. Ultra Pet's smaller kibble size combined with calcium and phosphorus helps keep their teeth in tip-top shape. We've added omega-3 to support their heart function while keeping your little one strong and healthy. Ultra Pet has included chondroitin, glucosamine, and green lip mussel extract to help your dog's joints, and L-carnitine to manage weight. Prebiotics play a crucial role in maintaining a healthy digestive system by nourishing the good bacteria in your dog's gut. The best part? Ultra Pet offers a 100% money-back guarantee. Visit your local vet or pet store to make the switch now. So why does it work? So explain why it works, because I love this concept. I love the fact that having a mentor, and I'm going to start by saying, I think a lot of vets take some of their problems home or to their friends that potentially are not vets and are not necessarily in the best position to necessarily advise them to work through some of the things when there are challenging situations, nor can they truly understand some of the situations that we face. And I'm talking doom and gloom here because obviously it's easier for us to discuss the pain points than it is to say, oh, it's just nice to have a friend to bounce things off or to be like, high five, you did a great surgery there. But like, why does mentorship work?
So mentorship works, which I guess the first question is, how much time do we have?
Let's go.
I'll try and be as concise as I can. But mentorship works for so many different reasons. If we're talking about the doom and gloom side of it, from the mental health perspective, it's not just about having someone who can give you that high five, who can like tell you like, hey, you're doing a great job. But it's having someone who can have the challenging, hard, edifying conversations and really push you to expand your bounds. So I usually talk about, there's like the comfort zone, there's the growth zone, and then there's the panic zone that's out there. And a lot of new grads, they get thrown into their first year in practice, which is the hardest year in practice. And they're literally like sink or swim. They're either going to be successful and they're going to just grind it out, or they're not going to be supported, or they're going to be torn down and they're going to leave the profession. Like it's crazy looking at the statistics of that. But when you throw mentorship into the mix and you have someone who's able to sit down with you and say, all right, I've been where you've been. We're going to make a list of what you want to focus on in the first 3 months, and then in the next 6 months, and then in that first year. And we're going to set up an action plan for how we're going to achieve those goals. You're going to see, like, if you were to take two populations of new grads and one that had not even say structured mentorship, but just focused mentorship, and then the other group that had overview of mentorship, but not true mentorship, you're going to see that the skills and knowledge and confidence of the mentorship group are going to be dramatically further than the other group, essentially. And part of that is because you not only had someone who was there and believed in you, but you had someone who was able to sit you down and, again, like have those edifying, challenging conversations of saying, okay, I saw, like, let's say it was you wanted to get better at canine extractions in your dentals. And instead of saying, oh, you're just going to do a lot of them, they sat down and said, all right, we have a couple of these that are coming up over the next couple months. What do you need from me as your mentor to make you more successful? And then you as the mentor are also going to sit down and say, all right, I watched what you did on these last couple ones. Why do you think that worked? Why didn't you think that other thing worked? How do we make it better? And then providing that feedback. So I'm bunny trailing a little bit here, but
no, but it makes sense to give examples in terms of, the process. I love it.
Yeah. So essentially it's having that person that is your teammate, in your growth process. And that's one of the main reasons that mentorship works. But again, like there's that relational side of it of just having someone who's saying, like, I'm here for you. I'm going to help you grow. It's going to be hard and it's going to be uncomfortable at times, but that is going to be the best way for you to grow and achieve not only what your goals are, but far surpass them.
And is there an accountability aspect to it? Is it a case of going, sometimes we don't sort of expose ourselves to certain things because, like you say, it's uncomfortable or scary. And having a bit like having a coach, which would be interested to sort of see what the difference in definition would be. But, to say, I'm going to actually encourage you to face the sort of situations that you are currently avoiding. And is it that you're then accountable because someone is managing or watching your progress?
Oh, there's certainly accountability. And it's very much a two-way street when we talk about these things. Because a lot of times people talk about mentorship of being like, oh, I have a mentor. They're going to be the one who guides me. They're the one who's going to control the environment to a degree. And I'm going to learn from them. Whereas, again, going back to that culture of mentorship, the mentor also benefits a lot from having someone to teach. Because I think was it like Einstein or someone who said, like, you don't fully understand something until you're able to teach it well. And again, so you're going to improve in your skills and knowledge and confidence as a mentor by having a mentee, but you're going to hold each other accountable. So if you both say, okay, we're going to meet at this time on this day at this frequency, And each time we do meet, we're going to talk about different types of cases. Like it's the mentee's responsibility to write down these cases, to bring them to the meeting. But equally so, it's on the responsibility of the mentor to be spot checking some of their SOAPs and their records, following behind, so that when it comes time to have that meeting, they can not only talk about the things that the mentee has brought, but the mentor has also brought things to the table for them to talk about. So yes, there's certainly accountability on both sides.
And is it important to have a mentor within your practice, or are there situations where a mentor can be someone external?
Oh, for sure. I would say it's more beneficial to have someone who's boots on the ground in the practice. So that way, say you got this case, it's crazy, or this client is just, you don't know how to communicate with them. It's a lot easier to be able to just pop into the next room and say, hey, I need you. Can you give me 5 seconds or 10 seconds to talk about this? But that doesn't mean that it can't be a virtual type of mentor. There are so many programs that are out there that provide that type of mentorship. And it benefits so many people, because I think about the new grads who are starting in rural practice. And just as you mentioned, like maybe they're in this like niche part of veterinary medicine where there aren't too many mentors to actually mentor them. And so to have someone there, you can pick up the phone and you can say, hey, I have a question. Can I talk to you? It really breaks down those barriers, and it takes away a lot of the fear that a lot of new grads have, just by having someone who is there and is willing to say, yeah, I'm here to chat with you. I'm here to help you. I can put down what I'm working on, and I will stop what I'm doing and talk with you. That just takes a lot of the fear away.
Yeah. And are there any times where the relationship or the personalities are such that the current relationship is not necessarily conducive, and it's best to recognize that and find a new mentor? Have you faced that?
I haven't faced it personally. I have seen a couple instances where the quote unquote assigned mentor and mentee don't exactly jive very well. But more often than not, what ends up happening is that there's just a breakdown in communication and mentorship style to a degree, but a lot of that can be flushed out right in the very beginning, when you have that sit down conversation with them and you say, okay, what is your learning style? What's your communication style? And just getting to know that person on a human level. Usually within those, kind of like with any person, you kind of get an idea where you're like, I don't really know if I get along with this person too well. And in those instances, like it's a lot easier at the start to say, hey, I don't think this is the best relationship. But even so, like that's where it's really good to bring in a third party and say, all right, are the things that I'm feeling and the things that I'm hearing, are they actually true, or are they just my own self-defense against my insecurities? So that's one thing to kind of break down. But say you're a year in to your mentorship and you've just been like putting blinders on, being like, I just got to get through this year. I don't like my mentor. This isn't working out. I think in those instances, again, it's really important to have that open style of communication and to say, okay, I feel like we're having a lot of tension here. What do you feel that as well? How do you see us working? Like, do you see us working through this, and how does that happen? And again, it might be the kind of level where you need to have a third party into the conversation to be able to, again, have that constructive feedback. But ultimately, if you're in a supportive practice that has a culture of mentorship, they'll be able to say, you know what? Yeah, this isn't really working all that well. There are certain aspects that maybe you can still go to that person for, but for different areas of mentorship, maybe you need to have a different type of mentor. And that kind of goes into, there's the style of mentorship called the mosaic mentorship to a degree, where you don't just have one single assigned mentor. You have multiple mentorships, mentors that are in your sphere. And so that way, when you have certain challenges or certain questions, you go to one person. When you have different type of, maybe it's communication, you go to a different person. And that is absolutely okay. Each of us have our own strengths. There isn't like a magical veterinarian who's a perfect mentor who does everything right and has all the right answers. Like, no, we're still human. So that's one thing to remember as well.
And what would you say makes a good mentor? So like you said, you've just answered to that to a certain extent, saying, there are obviously different people who you may resonate with or may be really good at one aspect of mentorship and maybe not have the time or capacity. But in an ideal situation, what makes a good mentor to support someone who needs one? Is it experience?
Yeah, no, the kind of words that come to mind when I describe a solid mentor is going to be someone who has the effort to be a mentor. They have the attitude, they have the empathy, and then they have open communication as well. So those would be the main things that I would think about whenever I'm facing someone who wants to be a mentor or is a mentor or is trying to figure out how do they improve as a mentor, which I guess I could add that to the list as well. It's like, are they constantly learning? Are they constantly growing? Or are they the kind of person who's like, I've been in this for 30 years, I know what I'm doing type of situation? Because if you're not constantly growing, then you're probably going backwards quite a bit. But those would be the main factors that come to mind when I'm trying to define what a good mentor is.
So it's not someone who's been in practice for so long and knows how to do everything and is a phenomenal surgeon, so can show you the surgical skill set or whatever. It's more the personality traits and like you say, the desire to try and meet the person's needs as and when they need it.
Mm-hmm, for sure. And I mean, I don't want to discount the people that have a lot of clinical experience, because that's the main thing new grads are looking for when they go into practice is they're like, I want someone who can give me the answers to what I need to do in this situation when I am 30 minutes behind on my consults and I just need to get this thing done. So there's definitely value in having someone who is clinically skilled and knowledgeable. But the bigger part of that is going to be the personality. It's going to be the person and their skill set there. And that's why I say, like, everyone can be a mentor. Everyone has the capacity to do that. And you can be 1 year out of vet school, or you can even just be like 6 months out of vet school, and you can still be a mentor, because you can be a mentor to the pre-vet students. You can be a mentor to the veterinary students. And you can say, this is what I've learned in practice. This is what I learned through vet school. This is how you should approach this, that, or the other that's related to vet school. And quite honestly, I would say the people that are like 2-3 years out of vet school are the best mentors to veterinary students, because they are fresh out of the trenches. They know what they're going through. They know what is happening in the veterinary vet school world, and they can speak to it. I mean, I'm 5 years out and I'm starting to see that there are things that are so different about vet school now from when I was in school that I'm like, can I even speak to some of these things? Like, that is how fast things are changing. So yes, it's not a particular like clinical skill set that makes you a good mentor. It's that personality. It's being a human, quite honestly, a good human. But everyone has the capacity to be a mentor. And I know I've talked about a couple different models of mentorship, but the other one that I think about in this respect is called plus, minus, and equal mentorship, where at any given stage of your career, you should have these different forms of mentorship, where we talk about the plus is going to be someone who's more skilled, more knowledgeable than you to be your mentor. The minus are going to be the people who are less skilled and less knowledgeable than you for you to mentor. And then the equal are going to be your peers, and they're going to be of similar skill and knowledge, and you're going to both mentor and be mentored by them. But in that process, again, you're continually growing. You're continually looking for ways to advance your skills and your knowledge.
And where would you say the responsibility of mentorship starts and ends? I mean, there must be some situations that mentors find themselves in where they go, like, this is beyond sort of the expectation here. I can't, for example, be at the other end of the phone every time you have a question about the dose of something. Mm-hmm. Or, I can't be answering, or I can't be dealing with every single case that you have on a daily basis. Like, so what is the sort of general expectation, and are there ever any issues where you have to redefine the limitations?
Mm-hmm. No, there are certainly limitations to that. And that's where having that conversation at the start of your mentorship is so important, and talking about, like, what are your expectations? So say you're a new grad and you're going into a practice. A lot of times I'll tell them, okay, talk about, like, what do you need in regards to surgery, or in regards to your consult schedule. And so I'll say, like, okay, are you expecting your mentor to be physically scrubbed into the surgery with you for X number of months before you sit down and say, all right, do you still need me, kind of thing? Or are you expecting, maybe you've done a ton of spays and neuters and you feel really confident and you're like, I don't need you in I don't need you in the surgery suite. I don't even need you in the building, type of situation. So those are the kind of conversations to have at the start. And it's not to say that that's going to be the same the entire way through your career, because you'll be having those sit down conversations on a week to week, month by month basis and saying, okay, how do you feel about this situation? Do you still need me? What's our expectation there? And equally so, maybe for consults, are you expecting to have hour-long appointments for your first 2 weeks? Where do you expect your mentor or at least a senior veterinarian to be so that if you need help, you can grab it? Are you expecting to be able to do solo afternoons your second week in? Is that going to be a month in, 3 months in? Just setting those expectations is so important at the start. So that way you're not having these situations of being like, this is way out of my depth. I don't know why you're expecting me to be at your beckoning call at every single minute. Whereas if you didn't really define that at the start, like that's on both of you. So as the mentor, it's really important to also ask these questions, because a lot of these new grads don't know to ask them. Like they just know to ask about mentorship. So yes, but to kind of say, okay, maybe 6 months down the line, and an extenuating circumstance comes up. I think that's where, again, having that relationship and that level of trust with your mentee to say, you know what, this is outside of the remits of what we can, like our mentorship relationship. I'm going to basically refer you into this another person that can help you, or, hey, let's look at resources together that you can look into when I'm not available. Which again, you can kind of talk about that at the start. But I think again, having that level of trust is so important, so that if these situations arise, it's not sticky. It's something where you can say, hey, we've encountered something we haven't thought of or dealt with before. Let's handle it together. And that way you can actually strengthen your relationship rather than tear it down.
Oh, I love that. Are you ever too like old, or have you been qualified too long to ask for a mentor? No. Is there a place for mentorship at every stage of your career?
Every stage of your career, there is a possibility for you to be mentored and for you to mentor others.
So that's something that is an acceptable thing to say, look, I have capacity now. I'm at a stage in my career where I feel that I could best support, the people who need it. But that's not necessarily going to be a long-term, position I find myself in. Is it all right to be able to say, okay, I'm calling it a day?
Mm-hmm. Oh, for sure. I think there's definitely a level where the type of mentorship will vary, because it may be that you get to a point in your career where you're like, you know what, I don't have the capacity to do structured mentorship anymore. Like I can't take on another new grad. Like I'm not going to be their person in this respect. But you'll still be providing a unstructured type of mentorship to the staff members that you work around. And kind of going back to that original question about mentorship, the reason it works so well is again, like that culture that happens because you switch the viewpoint from being inward of thinking about like, what can I get from this relationship? What do I need all the time, to being, how do I help the people that are around me? How do I look out for them and care for them? And that is like, I would say, the basis where mentorship comes from. Sure. You can structure it out the wazoo as you want to, and you can build it up and make it this big program. But on its basic level, like everyone is always providing a level of mentorship to the people that are around them that they work with. So you can't escape it.
And it's incredible. And I mean, you think about sort of mentorship in terms of vets, but are there mentorships available for all personnel within the veterinary practice, receptionists, nurses, techs?
So there are structured programs, especially when we talk about veterinary technicians and nurses. But outside of that, I wouldn't say there's like structured programs for the receptionists. But again, like within your practice, you should be looking for ways to mentor each other, because I know when we talk about, say, receptionists, they can feel pretty isolated in their little island of the front of the office, making the phone calls to the back, being the front lines for us. And one of the ways that we can support them and mentor them is to say, okay, what are things that you want to learn about? How about you come back and you see like what's happening in our treatment area on a regular basis, so you understand what the flow looks like. And that way, when Mrs. Smith comes in with her cat and she's terrified about leaving her cat here for the day, you can talk her through what it looks like because you've been there, you've experienced it. And again, like providing that level of mentorship on that respect. And then equally so, like you have the other staff members who maybe you have the high school student who comes in and they help clean kennels, and like that's what they're doing just to gain experience within the clinic, rather than just looking at them and being like, oh, you're the person who cleans, like I'm not going to teach you anything. Instead, you see them like as they're cleaning, they're like looking over at you as you're doing an aspirate. You can be like, hey, come on over, take a look at this. And you can teach them little bits throughout that. Because again, you're sparking that curiosity. You're bringing them into the team. You're showing them that you care about what they're interested in. And that's going to, again, build that level of trust. You get the benefit of teaching someone. That makes everyone happy. They get the benefit of being taught and being included into the team.
And it does make the work that you're doing feel a little bit more fulfilling at times, because owners don't always get to see what you're doing. So having the ability to, pass on knowledge, share things, discuss cases in a way that you wouldn't necessarily be able to do so either with your family members or your partner at home, having that ability to discuss things technically and grow in each case that you face. I think that is it's phenomenal. I'm sort of, my brain is ticking. So whose responsibility is it to get these kind of programs going within a practice? Is it the practice owner's responsibility, or is it the responsibility of, say, a new grad saying, look, I need a mentor. You need to please help me. So who should take charge?
So there's going to be some joint responsibility on this. So say you are the new grad who's coming in and you're saying, hey, I really am looking for mentorship. And the lead, maybe you're interviewing with the practice manager or the senior vet, and they're like, well, we haven't really had a mentorship program before. Then the two of them but they're willing to say, you know what, let's sit down and let's make this happen. I would say there's joint responsibility on both of those parts, because there's the responsibility of the mentee is saying, all right, this is what I think I need. But then also the senior veterinarian, if they're going to be the primary mentor, to also say, all right, let's sit down and actually write this out and maybe write a mentorship agreement. So everyone will have some level of responsibility in that, but I wouldn't say that there's one single person that can take on everything. Because as that lead mentor, you'll also be sitting down with a practice manager and saying, all right, what can we do? What are our expectations financially for this new grad? We know we're going to lose money in the first year because I'm taking more time to teach them. What are some of our allowances on that side? Equally so, maybe you're on a pro-sal type of finance or contract. And so the new grad, they're saying, right, this is our expectation for when you'll start to earn your production within the practice. And if we're not meeting it, then we need to sit down and say, okay, why isn't that happening? So there's that respect. Then they'll also sit down with the team and they'll say, all right, hey, we're bringing on a new grad. We'll talk to the receptionist about what their schedule is going to be, talk about what kind of cases are allowed to be scheduled with them for the first month or two, talk with the technicians and say, hey, new grad here, they're going to need your love and support to get through this. So again, every single person will have responsibility within this mentorship program. But if you were to have to pick a person, I would say that lead mentor is going to be key in developing the program itself. But thankfully, you don't have to do it from the ground up. There are a lot of programs that are out there. If you're like, I need a framework for what a mentorship program looks like you can reach out to so many of these amazing programs that are out there. You can get that framework. They can get you started. And then from there, you're just kind of filling in based on what your practice looks like and based on what that individual mentee needs. Because again, it'll look different from mentee to mentee.
So if I'm wanting to be a mentor, I've recognized someone within my practice who would be phenomenal as a mentor, but they do need some guidelines. Where can they look for these? Mm-hmm. Which are the ones that you can direct us to? Which are the ones that you feel that work well, that are great resources for people who are interested in taking on these programs?
Oh, I have so many. I think right off the top of my head, my good friend Kate Boatwright, she actually developed a mentorship program framework for practices that are in that exact situation. They've never done mentorship before. They want to start with something. something, she has a nice like step-by-step thing that they can look into. Of course, there's always MentorFit, Ready Vet Go, Possibilities Vet Med, like you name it. There are a ton of programs that are out there that want to support mentors. And all you have to do is reach out to them and say, hey, I have no idea what I'm doing. Help me. And they will give you all the resources that you need because they want to see you succeed. They want to see your new grads succeed, and they want to see your practice succeed as well. So tons of resources that are out there. It's as simple as just reaching out to someone and saying, I want to do this. Let's set this up.
And I mean, you are obviously speaking about this a lot. You're talking about this on your social media platform. You podcast about this. You have great reach in terms of talking about the benefits of mentorship. Is that something you're super passionate about and you can see yourself doing longer term?
For sure. Yes. I love clinical practice. I love being able to talk with people and help their pets. But the thing that really gives me so much passion and fulfillment in my role is being able to not only support the vet students and the new grads who come through our practice, but being able to talk with so many other vet students and new grads that are out in the world. Like I get messages all the time from people that are going through really challenging mentorship things, or maybe they had to switch practices or they just weren't getting along with their mentor, and being able to just sit down and talk with them. And again, I don't have all the answers. I'm only 5 years in, but I'm able to kind of resonate with them, and I'm able to provide the resources and again, send them on to someone who does know better, who has more experience. And that's one thing that I find is really enjoyable, because as much as I can be thought of as a mentor, I really want to be thought of as someone who can then connect people and to basically get them to the next step where they need to be, rather than the person who has all the answers or all the fixes.
And obviously being very active on social media, but also as a podcaster, you reach a wide audience. Some of the work that you're doing obviously benefits us as veterinarians and practices in terms of all the discussions you're having on mentorship, but you also are very proactive about discussing some of the other issues that we face, or putting some humor to some of the situations we find ourselves in. Why do you do that?
I do that partly as an outlet for myself. We're veterinarians. We're really good with dark humor. So, there's a side that is very cathartic, to talk about some of these things in that respect. But I'm also just someone who loves to be a little bit goofy. I'll be honest, I don't really show the full side of that on social media, but the people that I work with get to see that full force, much to their detriment. But yeah, I do that because again, I love it. It's fun to be creative in that respect. And again, I've seen the community on Instagram, which is primarily where I'm at, grow tremendously. And yes, we've seen our fair share of ups and downs in the last year or two. But when I get to actually meet with those people in person, it is incredible just how amazing our profession is. And I'm just filled with so much hope and joy about what we get to do on a daily basis. Just by, again, getting to meet these people in real life. Like it can be very isolating, especially as a new grad. Like you leave your friends that you're classmates with, and then you start in practice and you don't hear from them. You can't see them every day. But to have that community, whether that's in your practice or just using social media, and be reminded like, hey, you're not alone in this, and that there are tons of people that are out there that want to support you. Like that's enough reason enough for me to talk about mentorship and to support people that way.
And I think the fact that you discuss mentorship, it also allows pet owners and other people who are accessing your social media accounts and enjoying your content to just see that we are human. And it just gives that kind of connection potentially that they would not otherwise not have, because I mean, obviously there is the professional side and having, having that kind of respectful boundary, and the way in which we have historically managed our clients, to letting them know that we suffer with some of the same things. I mean, you talk about imposter syndrome. I mean, this is obviously something you will deal with if you're a mentor. This is something we see within our profession. I mean, tackling some of those topics gives owners an insight into us as human beings.
Mm-hmm. Yes. Like it comes back to being a human, being a person, and caring for each other on that basic level to start. And then everything else grows from there.
And do you think that that is going to improve owner perception of us as veterinarians?
I would hope so. And that's a whole other conversation, which we don't have time for today, is the role of medical professionals being on social media and like what's allowed, what isn't allowed, what is beneficial, what's not. But at its core, I think it is very important for us to be present on there, not just from a medical information standpoint, but just from a standpoint of letting them see who we are on a human basis. Because again, like I have clients who come in and they're like, I love your videos. Like they're so funny. And I'm like, oh my gosh, you see my videos because they're more targeted for veterinary professionals. But it like they love it. They love to see it. They love to know that their veterinarian who cares for their pets is also a pet owner and also deals with a lot of the same hardships that they do.
I totally agree. And I mean, you're far more likely to engage in positive conversation when you see the positive messages that you're putting out. Like you say, owners sometimes come in and they're quite familiar because they feel they know you, so people are like, oh, I see you, I know you. That is only a positive thing because, we are always trying to sort of bridge the gap between pet owners and veterinarians, particularly when we know that we have limited time with them, is to give them an insight into sort of what happens in behind the scenes, that things do happen without them necessarily historically being privy to that information and have access to those sort of insights. So I think the work that you're doing on social media is phenomenal. I enjoy it, obviously, as a veterinarian, who's someone who can relate, but also it's very entertaining. But also, I just love the work that you're doing. And thank you for taking the time to discuss mentorship. It is something I am certainly going to make a point of looking into. And I'm feeling very sheepish about the fact that we haven't prioritized this historically. But, we're all just trying to become progressively better informed and just do things from fear-free to, us as South Africans don't always have access to these kind of things, and the world is becoming smaller and smaller. Mm-hmm. So the fact that we can have these kind of discussions and become better at communication fundamentally is wonderful.
Absolutely. Well, thank you so much for having me. This has been so much fun.
Thank you, Dr. Moriah.
It's always fun when someone gives us like, I'm going to give you a platform to talk about mentorship. And I'm like, do you realize what you're doing?
Well, I know we can go on for hours and hours. And I know that as a podcaster, the way in which your brain works. You're like, I could get into this. We could do this all day. But we're limited to people's capacity when they watch these things back. But I'm super, super grateful for your insight. And I know that, these kind of things we can go on and discuss. And I'm sure that when the content goes out on social media in terms of our real extracts, if people have questions, they can obviously ask and you can provide more clarity. But if people want to get in contact with you or access your social media or the mentorship discussions, where can they find you?
Absolutely. So I am pretty much found on Instagram at dr.moriah.McCauley. You'll find all the hilarity there. Otherwise, I'm pretty active with a podcast, which is So You're a Vet Now What, which is available on every major podcasting platform. So you can take a listen to episodes there as well.
Thank you. This has been a great conversation. I'm super excited to get out there. And thank you for taking time out of your busy schedule. I know that you've got a lot on your plate with all the work that you're doing. So thank you.
Well, thank you so much for having me. It's been fun.
It's been a pleasure. Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Carra.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Oh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.